Welcome to another episode of Healthy Living Podcast. My name is Niyama. I'm your host. My friends call me Nia. So today I'm going to dive deep into the world of nutrition and heart health. So this episode I'm going to explore the incredible power of omega-3 fatty acids and how they can boost your heart health, especially during midlife. So if you are like me, a woman that is almost going to be 50 years old, this is the podcast to listen. So as we age, of course, taking care of our cardiovascular system becomes increasingly important, and of course omega-3s have emerged as a superstar nutrient in promoting health of your heart. So get ready, because you're going to really see and discover the science behind omega-3 fatty acid, and also learn practical tips on incorporating them into your daily routine. So pen and paper ready. I hope you have your notebook, sister. Let's get started on this journey towards a healthier heart. I want you to understand the importance of omega-3 fatty acids and also the science behind their heart protective properties. So number one, the role of omega-3s. Amazing. You need to learn about that. And I'm going to guide you through the best food sources of omega-3 fatty acid, like the fatty fish, salmon, mackerel, sardines, flax seeds, chia seeds, walnuts, algae-based supplements. So important that you learn these, because they can really help your heart. All right, so fatty acid. I'm sure you have heard of omega-3 fatty acids, especially EPA and DHA. They have powerful heart protective properties, and research suggests that omega-3s can reduce inflammation. And I have noticed a big difference when I consume more of them. Then I won't feel so bad with my knee and the inflammation. So they definitely reduce inflammation. They also lower triglyceride levels, and they improve overall cardiovascular health. So if you want a good strong heart, make sure to consume a lot of fatty fish, flax seeds, like I said earlier, chia seeds, walnuts, because they are excellent sources of omega-3s, while supplements also will provide you with additional support. So when you choose omega-3 supplements, just seek out reputable brands and also consult with your healthcare professional for guidance. I always recommend to go shopping in the health food stores, because they have so many amazing products and items that will benefit you and your heart. So talking about benefits, what are the benefits of omega-3 fatty acids in reducing risk of heart disease? Well, they have been widely studied for the potential benefits in reducing the risk of heart disease. So I'm going to share with you some key benefits. I hope you're writing down. Number one, lowering triglyceride levels. So omega-3s, especially EPA, like I said earlier, and DHA, they have been shown to significantly reduce triglyceride levels in the blood. So high levels of triglycerides are associated with an increased risk of heart disease. So you need to consume omega-3 fatty acids. Number two, increasing blood pressure. A lot of Americans have high blood pressure. So omega-3s, they have been found to help lower blood pressure, particularly in people with hypertension. So by reducing blood pressure, the omega-3s can help alleviate strain on the heart and also lower the risk of cardiovascular events. Super important to know. This is great information. If you know someone who's suffering with high blood sugar, high blood pressure, please make sure to let them know about omega-3 fatty acid. Number 3, reducing inflammation. Like I said earlier, chronic inflammation in the body is linked to the development and also the progression of heart disease. Be very careful. So omega-3 fatty acids have anti-inflammatory properties, and they will help reduce inflammation throughout the body, including the blood vessels and your heart. Number 4, preventing plaque formation. Yes, omega-3s have been the amazing natural remedy, yeah, and they will help prevent the development of plaque in your arteries, a process known as atherosclerosis. I don't know if I butchered the name or if I said it correctly. So by reducing plaque formation, they help maintain blood flow and also reduce the risk of blockages that can lead to heart attacks and also strokes. And I know you have heard so many examples of people that out of nowhere they had a stroke or they have a heart attack. Number 5, improving HDL cholesterol. Yes, a lot of people have no idea about that. Omega-3 fatty acids, they can increase levels of high-density lipoprotein, HDL cholesterol, often referred to as good cholesterol. So we have good and bad cholesterol. So the higher levels of HDL cholesterol, they have been associated with a reduced risk of heart disease. Number 6, preventing arrhythmia. So the studies that were done, they suggest that omega-3 can help regulate heart rhythm and also reduce the risk of abnormal heartbeats or arrhythmia. So this benefit may be particularly important for individuals who have had a previous heart attack or have a history of heart rhythm disorders. So it's important to note that while omega-3 fatty acids offer potential benefits for heart health, they are not a cure all or a substitute for a healthy lifestyle. So you need to really be careful. You have to have a balanced diet, you have to exercise regularly, you have to manage your stress levels, because a lot of these diseases, they come about due to stress and not being able to manage stress correctly. And of course, do not smoke, do not use any drugs, because this is essential if you want to maintain your heart health. So just remember to always consult your healthcare professional before starting a new supplement regimen or before making significant changes to your diet. It's common sense, right? So now let me talk about the science behind heart protective properties of omega-3 fatty acids. This is backed up by scientific research and several mechanisms that have been proposed to explain their beneficial effects on cardiovascular health. So number 1, what I said earlier, triglyceride reduction. So the omega-3 fatty acid, they have been shown to lower level of triglycerides in the blood, and a high level of triglycerides, like I said earlier, are associated with the increased risk of cardiovascular disease. Number 2, anti-inflammatory effects. So chronic inflammation plays a critical role in the development and also the progression of heart disease. So you have to be super careful about that. And using omega-3 fatty acids is going to help you because they have anti-inflammatory effects. It will reduce your inflammation in your blood vessel as well as on other tissues, and will protect your heart and your blood vessels. Number 3, blood pressure regulation. Yes, studies have demonstrated that omega-3 fatty acids, in fact, can help lower blood pressure. Yes, particularly in people with hypertension, meaning they have high blood pressure. And high blood pressure is definitely a risk factor for heart disease. And by reducing the blood pressure, omega-3s, they can help protect against cardiovascular events. Number 4, modulation of heart rhythm. Yes, like I said earlier, omega-3 fatty acids have been shown to have arrhythmia suppressing properties. So they will help to regulate your heart rhythm, and they may be particularly beneficial for individuals with heart rhythm disorders or those who have had a previous heart attack. Number 5, improved lipid profile. So the omega-3 fatty acids, they have been found to increase levels of high-density lipoprotein, HDL cholesterol, which is the good cholesterol, like I said earlier, while it will decrease the levels of low-density lipoprotein cholesterol and total cholesterol. So maintaining a healthy lipid profile is very crucial, very important, my sister, for heart health and also reducing the risk of cardiovascular disease. Number 6, preventing plaque formation. Like I said earlier, the plaques in your arteries. And the studies have shown that to reduce the production of inflammatory markers associated with plaque formation and also stabilize existing plaques, preventing their rupture and the subsequent formation of blood clots. Omega-3s have helped that prevent that formation. So very, very important. And remember the diet that I said, it has to be primarily a diet full of fatty acid, like salmon, mackerel, sardines. Just eat more of these. And in cases where dietary intake is insufficient, then make sure to buy omega-3 supplements, because they will provide a convenient way to ensure adequate intake. But of course, it's always advisable to consult with a healthcare professional before you start any new supplement regimen and before you start making significant changes to your diet. So just please remember, you need to take care of your heart. You need to take care of your heart. You know, the heart is the most important organ that you have inside of you. And you need to really be careful that it is strong, that it is healthy. So before I stop the episode here, let me do a recap, a quick recap of what you have learned today. So omega-3 fatty acids, especially EPA and DHA, they have powerful heart protective properties. Number 2, the research suggests that omega-3s have the potential to reduce inflammation, to also lower triglyceride levels, and also to improve overall cardiovascular health. Number 3, fatty fish, flax seeds, chia seeds, walnuts are excellent sources of omega-3s, while supplements can provide and will provide additional support. Number 4, when choosing an omega-3 supplement, make sure to seek out reputable brands and also always consult with your healthcare professional for guidance. So I hope you have enjoyed today's episode and that you have learned valuable insights. Please don't forget to join me for my next episode, which should be tomorrow. And if I'm not here tomorrow, then on Wednesday evening, I will continue to discuss the ways to optimize your health and your well-being. So remember, my sister, stay healthy. And until next time, stay blessed, stay learning, stay focused, keep going, stay thriving, be unbreakable, and take care of your heart.